Good afternoon, everybody. My name is Brian Hagopian, and I am with the Boston ISPE chapter. It is now 12 p.m. Eastern Standard Time, and I'd like to welcome you to today's webinar, How to Take the Guesswork Out of Your Water Purification System. Before we get started, I'd like to thank our program sponsors, DPS Group, ICQ Consultants, Macy Bioservices. A few items to go over to let you know how to participate in today's event. There will be an opportunity to submit text questions to today's presenters by typing your questions into the Q&A session on Pigeonhole. A link to the Q&A platform has been provided in your confirmation email as well as the chat box. You can send your questions in at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. If we do not get to every question by the 1 p.m. deadline, we will follow up with an answer by email. I'd now like to introduce our speaker, Brian Hagopian, CPIP, President, Clearwater Consulting. A few tidbits about Brian. He has over 35 years of hands-on industry experience, is an instructor at Worcester Polytechnic Institute's Biomanufacturing Education and Training Center. He is a charter member and past president of the Boston area chapter, is one of only 10 people to have received the Hank Mohs Lifetime Achievement Award, and is one of 150 people in the world to have attained the Certified Pharmaceutical Industry Professional Certification from ISPE. More globally, Brian is an active member in the ISPE Critical Utilities Steering Committee, and has been an author and contributor to several key ISPE technical documents pertaining to critical utility systems. At this point, I'd like to turn it over to Brian. If there are any questions, please remember to text them to Pigeonhole.
All right, thank you, Brian. Let's see, give me a second here to get the right screen. And here we are. Okay, so first things first, I'm going to take myself, thank you, Brian. I'm going to take myself off the webcam right now. I'll be back at the end, but thank you for the introduction. So today we're going to spend a little time talking about water purification. I think we've all had enough about COVID-19, and so hopefully this will be a distraction for people. So thanks for tuning in. Water happens to be one of the most important substances used in the pharmaceutical industry. It's used everywhere, whether it's used as an ingredient, a diluent, an additive, a cleaning agent, and for a ton of other purposes. In fact, any of you who've been through FDA inspections probably know that inspectors almost always look at the water system. So what we're going to try to do today is give you some things to help you understand as much as you can about a system that you may have and how it works. It's one of the main reasons we're here today. Okay, two things before we start. There are a lot of people who consider themselves water purification experts. And if you get, a half dozen of them together in the same room at the same time, you'll probably get a half dozen different opinions on how to best purify water. What I've learned over the years is that people work in different industries, they have different backgrounds, they have different education, and therefore they have a different perspective on how things work. As an example, a microbiologist may look at things one way, whereas a mechanical engineer will look at things a different way. Now, my background is in chemistry and biology, but I'm also a self-taught engineer. I'm a systems thinker, and I've designed and built water purification systems for over 20 years. So I'm going to try to bring all that background together to talk about my perspective on water purification today, okay? Now, Brian Hagopian talked about the Pigeonhole link for you to ask questions. Please feel free to use that. We're not going to take any questions during the presentation. We'll take them after. Oh, and one more thing before we get started. While many of you may be feeling some isolation and boredom because of this stay-at-home order, I'm actually on the opposite end of the spectrum. Right before the stay-at-home order was given, I have a couple of immunosuppressed people in the family. So we invited my daughter, her husband, and our 2 grandchildren, ages 3.5 and 1.5, and to come self-isolate with us. So if you hear the pitter-patter of little feet or maybe something a little louder in the background, you'll know why. All right. So water purification doesn't really have to be complicated, but a lot of people like to make it seem complicated. So my goal today is to break down water purification into its simplest elements for you. Now, I will tell you, there are surely nuances to almost everything I'm going to cover today, okay? And in that respect, I kind of look at water purification as I would look at an onion, lots of different layers. We're going to cover some of the outermost layers today. That's my plan. And if we need to dive a little deeper into a couple of areas, I'm happy to do that. But I'm going to try to give you the framework so that you can better understand your own system or systems that you work on, how it's supposed to work, and the right questions to ask when things seem to be getting ready to fall off the rails, okay? Now, if you want to do a deep dive into a few specific areas, just let me know through the Pigeonhole portal, and we'll try to cover as much as we can in the time we have, okay? Now, the other thing I want to say is I could probably speak on this subject for close to a week nonstop, and I'm going to try to squash everything into 40 or 45 minutes. So I'm not going to be able to cover everything. I'm probably going to go over a few things, maybe not in as much detail as one would like, but you know, we've got some time constraints. So simply stated, where do we start? All right, let's kind of put our thinking caps on. Now let's think logically. And if we have any Trekkies out there, you're probably going to recognize this. Or maybe you'll recognize this guy, but maybe you won't. Maybe I'm showing my age because I recognize the original Spock, Leonard Nimoy, who's from the Boston area. But you may recognize this guy. Okay, so where do we start with water purification? We got to answer 3 simple questions. What's our starting point? Where do we need to end up? And how do we get there? Right? Pretty simple and straightforward. Now, if we translate that into what that means for water purification, what does our starting point means? Hey, what's our incoming water quality? Where do we need to end up? Well, what's the final water quality that we need? And then how do we get there? All right. The third question actually turns into a couple more questions. Okay. So we need to understand the treatment processes that are available. And I'm going to spend a bunch of time talking about that and what each of these processes does. Now, the fourth question is how we get water from the point where we generate it to the point where it's used. Now, many people who are in the business of building water purification systems don't worry so much about this fourth question because typically they're going to guarantee the quality of water at the outlet of their system. Now, unfortunately for us, we don't go to that point of the system to use our water. We want the water to be of a certain quality at the point where we use it, right? We care about what comes out the end of the pipe, the valve, the hose, or the gooseneck. And this is really important, and it's something I've always thought was important, and it's something that needs to be addressed with every water purification system that's designed, okay? All right, so first off, right, number one, what's our starting water quality? Well, if we're gonna look to produce pharmaceutical grade water of any sort, whether it's purified water or injectable grade water, the assumed starting point is potable water. It doesn't matter where you are, if you're in the United States, Canada, Europe, China, Brazil, right? There are organizations in the United States, it's the US EPA that sets primary drinking water standards. Okay, there's the World Health Organization, and you know, there are places all over the world. Now, an important thing to understand is that if the source water, right, if your source water does not meet drinking water quality requirements, then the first thing you have to do with the water purification system is to treat the incoming water to turn it into potable water, and then you can make pharmaceutical water, okay? So assuming that we have potable water, the first thing that we want to try to do is understand our water quality. So we call up the municipality where the plant's going to be built, And here's an example of what they're going to give us. Okay, I actually did this for a client, and this is the information I got. There are regulated contaminants, there are disinfectants, there are volatile materials, there are disinfection byproducts, there are things that are called unregulated contaminants, there are some radioactive materials, and some heavy metals. Now, what a municipality has to do is tell us what's in our drinking water, or they need to test for things that make and ensure the water is safe to drink. Now, when looking at things from a water purification standpoint, these are all the things that we actually need to know. And the things that are highlighted in red are the things that the municipality is going to give us, or something similar to that. So all of the other things are things we need to test for, and it usually falls on the end user to test water for these materials, okay? Now, in order to understand how to treat them, I want to take a minute and kind of classify these contaminants. So let's kind of put all those contaminants into classifications. So the first one is, hey, particles or suspended solids. Then there are two different kinds of dissolved solids, those that ionize and those that don't. There are colloidal materials, dissolved gases, and bacteria and other living organisms, okay? Now, all the contaminants or impurities, and I'm going to use those two words interchangeably, although through the ISPE Critical Utility COP, we've had some back and forth discussion about what's a contaminant versus what's an impurity. I'm going to both consider them the same thing for the purposes of this discussion, okay? Now, why are these things important? Well, they're important because they may create variability with the things we're trying to do, whether it's an experiment or something else. And as scientists, we want to, eliminate as much variability as possible. So I want to dive a little deeper to gain an understanding of what all these materials are and how they may resist our attempts to remove them. So let's talk about particles or suspended solids, okay? I want you to, these are materials that don't dissolve in water. I want you to think of a glass filled with water that you throw a teaspoon of beach sand in, okay? You stir up the water and these things will be carried around. And as soon as you stop stirring, some of the larger particles are going to settle out right away. Some of the smaller ones may not settle, right? So particles or suspended solids are generally thought of as hard spherical particles. Moving water can keep more particles in solution. More dense particles and larger particles will settle out by themselves, and smaller particles may never settle. Now, there are several kinds of dissolved solids. Let me talk about ionized materials. These are things that dissolve in water, okay? Once dissolved, they're going to split into positive and negative ions. The solution will remain electrically neutral because we have equal amounts of positive and negative charges, okay? Now, one of the things with ionized materials is because the negative ions have electrons, they will conduct electricity, and we can actually measure how much electricity the solution will conduct. And that will give us a general indication of how many ions we have, right? And if you think about it, one of the most common measurements that we use is to measure the conductivity of water, or its reciprocal, the resistivity. The resistivity is a measurement of how resistive the water is to the flow of electricity, whereas the conductivity measures how conductive the water is. And there's a direct relationship between the abundance of these ionized salts and the conductivity of the water. All right, example of this is table salt, sodium chloride. Now let's talk for a minute about solids that dissolve in a solution that don't ionize. All right, these materials will dissolve in water, And once they dissolve, they don't form ions. So they don't add any electrical charge to the solution. We can't detect them as a change in conductivity. So we can't measure them. And how many are there by measuring conductivity, right? Their presence is a little bit more difficult to detect. An example of this is sugar or any other non-ionized materials. I want to spend a little time talking about colloidal materials. These are materials that are organic in nature and they contain carbon. They're generally considered tiny in size, but they're relatively large in molecular weight. Now, all colloidal materials, and I can't tell you why, but all colloidal materials have a slightly negative charge. They kind of exist. One of the ways I find easier to think about them is they kind of exist somewhere between a suspended solid and a dissolved solid. So they're a little too small to settle by themselves. And because they have a negative charge, they tend to repel each other. So they're held in solution by their small size and by the electrical repulsion between them. Now, it's almost impossible to detect their presence by conductivity. There would have to be a lot of these colloidal materials introduced to, water to change the conductivity. But the tool that we use to measure their abundance is silt density index. Now, colloidal materials, some parts of the country are fortunate. They don't necessarily have a lot of colloidal materials. But we in New England are blessed or burdened with the fact that we have a lot of these materials because we're on primarily a surface water supply. These materials can quickly clog up and gum up purification processes, okay? They're a huge concern and they can cause lots of problems and they have to be dealt with. I want to talk for a minute about dissolved gases. Now, dissolved gases are the most common ones are nitrogen, oxygen, carbon dioxide, and ammonia. These gases aren't removed by most purification processes, and most dissolved gases, they will dissolve more at lower temperature, or they have greater solubility at lower temperature than they do at higher temperature. And that's exactly the opposite of solid materials that dissolve in water. So it's kind of a little bit counterintuitive, but if you've ever tried to boil some water on the stove, you'll see that as the water's warming up, there'll be bubbles that form on the side of the pot, which is the dissolved gases starting to fall out of solution. Now, these happen to be the least understood and least studied contaminants. And in fact, there are a couple of contaminants that are, they're becoming more and more troublesome, and they're things we have to deal with. One of them is carbon dioxide. And it's troublesome because it's present in the air. It can dissolve into the water that's being held in a storage tank, and it will change the conductivity. It will add conductivity when it dissolves into solution. It's one of the reasons we put nitrogen blankets on our storage tanks to exclude ambient air and therefore carbon dioxide. Ammonia can be troublesome because some municipalities, including some of the ones that we're on, treat the water with chloramine, and if there is an excess of ammonia, it can pass through reverse osmosis membranes, it can pass through distillation units. So it's definitely something that needs to, that's a major concern and something you have to deal with. Now let's talk for a minute about bacteria, okay? One of the biggest challenges with bacteria is that they grow in colonies and they're not uniformly distributed in a water system, right? The way I look at it, and again, this is my chemistry background, they exist in equilibrium with their environment. So more food means more bacteria. The more food you have, the more bacteria can grow. One of the scary thoughts about bacteria is less than 1%, and in fact, some people may say less than 0.1% of all the bacteria in a system is free floating and therefore detectable. Now, why is bacteria a concern? Well, if we're doing any cell culture work, if we're growing, if we're growing mammalian cells, it's a big concern because bacteria competes for nutrients with the cells that we're trying to grow. Bacteria can replicate once every 30 minutes in the right environment. Mammalian cells can take up to 24 hours. And when you think about what might happen over a 24-hour period, we go from 1 mammalian cell to 2, but bacteria, we go from 1 to 2,800 trillion bacteria. Now, the vast majority, unfortunately, the vast majority of bacteria that is present in a system is found in biofilm, and we can't detect it. It's stuck in biofilm. It's not going to be in the water, and this is a huge problem, right? This is a huge problem. Got all this bacteria around, and we can't even tell it's there. We're seeing 0.1% of what might be in our system. So if we can detect it, chances are we're going to have some issues to deal with. So let me talk for a minute about how bacteria work. All right. The first thing, if we kind of go look at 1 through 5 here, the first thing they do, they get introduced to a system. They're freely floating around. They look for a place to attach, and they attach. Okay. Their bacteria are capable of building their own living quarters, as it were. They secrete biofilm, which kind of helps them make them sticky, and so that's their shelter. And now they're looking for food in the water, and if the water has enough nutrients in it, they're going to grow, and the biofilm is going to develop, and it's going to grow, and eventually the biofilm is going to send out scouts to go populate other locations in a water system. Okay, there are 2 ways to deal with biofilm. The pharmaceutical industry typically does regular sterilizations. As we're going to find out, the microelectronics industry likes to do something called nutrient deprivation, and it's a technique that I've applied to the pharmaceutical industry, and it works great for controlling bacteria. Now, I want to just say, without taking too much of a detour, I do want to say there's a big push on with the rapid development of what is called the rapid microbiological monitoring methods. These are nicknamed RMMs. And there are lots of advancements. They're happening almost on a monthly basis. But without detouring things too much, this technology shows a lot of promise for use in process control, but there are a lot more challenges. And if we have some time and you'd like, we can talk about some of these challenges. There are a lot more challenges that need to be overcome before RMM finds a place in product release and in quality control testing. Now, I picked this article out of the Boston Globe, and it talked about on a very high level or a very basic level how biofilms work. Okay, they self-organize, divide up into tasks, they secrete slimes, they can colonize new areas. Some of them hibernate, right? They can take in nutrients, they can get rid of waste. So it becomes a complex organism. It's not just a single cell organism anymore. Okay, so we've gone through that. Let's talk a little bit about where our water comes from, right? And how its properties vary. Now, we have well water and we have surface water. And depending on what water we have, the properties vary. Well water is low in suspended solids. Surface water is high in suspended solids. All right? Well water, because the water has been in contact with the ground for a lot longer, is much higher in dissolved salts, whereas surface water is low in dissolved materials. Well water pretty much has no colloidal content, and surface water has high colloidal content. If you think about, a lake or a reservoir, right? Leaves fall off the trees, fish swim around. These things all live. The leaves fall to the bottom. They take 2 or 3 years to decompose. And as they decompose, they form these colloidal materials. Eventually, the leaf particles get small enough that they get carried away in solution. And, like I said, there can be a lot of them present. They can really gum up a purification process. Well water doesn't have very many dissolved gases. Surface water has a lot of dissolved gases because the surface of the water is in contact with air. Okay, now from a water purification standpoint, water can meet drinking water requirements, right? It can be potable, but it can vary greatly from one place to the next. So just meeting the drinking water requirements by established in the United States or by the World Health Organization is one thing, but there is still a lot of potential variations. For example, in the greater Boston area, we're on the MWRA water system, which was fed from the Quabbin Reservoir. And if you saw, I flashed a picture of the Quabbin Reservoir that I happened to take as I was flying into Boston from visiting my son in Colorado. Now, if we go out to the Midwest, a lot of their water comes from deep wells, and those water sources have lots of different properties and characteristics. And here is a kind of on a general level what some of these major differences are. Now, so we've talked a little bit about the water source. The next thing I want to do is talk about the end use of the water. Okay, and I'm going to go through kind of each one of these. Now, what water quality do we really need? Well, you know, I used to hate it when I'd ask a question and hope for an answer, and people would say, well, it depends. And as I've gone on a little further in life, I've learned that, you know, it really does depend. So it depends on where we are in a product's life cycle. Are we in drug discovery? Are we doing research? Are we in the middle of pilot scale testing? Are we doing clinical trials? Or are we in full scale manufacturing? The answer to what type of water quality we need is dictated by kind of where we are. So I want to talk about some of the pharmacopoeias, some of the consensus standards that have been assembled for establishing water quality. So laboratories use CAP, CLSI, ISO, or ASTM specifications for purity. CAP is College of American Pathologists, and CLSI, I believe, is the Clinical Laboratory Sciences Institute. I might be wrong about that, but I think that's it. And they've got 3 different grades of water, type 1, type 2, and type 3. And you can see they've got a conductivity requirement and a resistivity requirement, which are the same, just expressed differently. There's a silica requirement and a bacteria requirement. We look at the ISO specs, and I took this from the ISPE baseline guide that was just published in 2019. The ISO specs speak about grade 1, 2, and 3 water for laboratory analytical use. They talk about some of the different approaches that are used to produce the water, and they give us the parameters, the quality parameters. Now, ASTM has 4 different types of water, but they also have a standard grade of water for bio applications. And one of the things that people forget about when they refer to ASTM specs is that there are 2 different parts to an ASTM spec. There's the type 1, 2, 3, and 4 across the top, and then there's also a specification for bacteria and endotoxin. And people commonly say, oh, I want type 1 or type 2 water, but they forget to call out a bacterial requirement, type A, type B, type C. And if you take a look, type B bacteria is the same requirement as the bacterial specification, which we'll see in a minute, for water for injection grade water. Okay, so let's be sure to remember to understand that there's a type and there's a bacteria spec as part of ASTM. Now, water for dialysis has its own requirements. These are taken right out of the ANSI standard. And there's a whole bunch of things that they look for. I will tell you that there's an effort between the US Pharmacopoeia and the dialysis folks to harmonize these water quality standards, but we're not there yet. And in fact, if you go to a place like Germany, the water quality standards for dialysis are stricter than the requirements for pharmaceutical grade purified water, but in the United States, they're not quite as strict. Now, for pharmaceutical water quality, and this is the thing we tend to be most focused on, there's a specification for both purified and injectable grade water. There's a TOC spec, a conductivity spec. Everybody tests for bacteria, but there's nothing called out in the USP, in the US Pharmacopoeia, that talks about and that lists this bacterial requirement. This was established by the United States Food and Drug Administration back in 1993 in their Guide to the Inspection of High Purity Water Systems. And in fact, where they said, hey, a purified water system is considered out of control if the bacterial population is greater than 100 CFU per mil, and a WFI system is considered out of control if the bacteria is above 10 CFU per 100 mil. And you'll notice that purified water does not have an endotoxin spec, whereas WFI does. Now, why is injectable grade water allowed to have bacteria? What do you think of that, huh? When you think about it, would you want water injected into your body that contained bacteria? In fact, the reason for that, and I'm just going to touch on this briefly, the reason for that is because of the challenges with sampling this water. So if we took a 100 mil sample and we found 2 or 3 hits, and the spec was 0 CFU per mil, we'd be shutting down a production line for what might be a sampling error. So the intent is that WFI grade water is sterile. There should be 0 CFU per mil, but the regulators realize that, hey, periodically there might be a sampling error or a transportation error or any one of a number of different things, and you might get a hit, and they don't want you to have to shut down the plant and recall product for what might be a sampling related issue. Now, the last thing I want to talk about from a water quality standpoint is the microelectronics industry. This industry literally is driving the field of water purification, okay? Now, take a look at the specifications for electronics grade water. Now, remember, we just talked about pharmaceutical grade water, and the TOC, or total organic carbon content specified, is 500 parts per billion. Electronics grade type E1 water has a specification of 5 parts per billion. That's 2 orders of magnitude tighter. And take a look at the bacterial requirements. Grade E2 water has the equivalent bacteria spec to water for injection grade water. But you know what? The microelectronics industry decided that grade E1 water isn't good enough for the work that they're doing now, for the semiconductor chips and what have you that they're doing right now. So they established an even tighter specification for when type E1 isn't good enough. They established an E1.1, a 1.2, and a 1.3. And take a look at these numbers. The TOC level is down at 2 and 1 parts per billion. Look at the bacterial levels. 1 per 100 mil, 1 per 10 liters. This is way better than WFI grade water. And I'm going to say to you that it may be worthwhile to consider some of the things that the microelectronics industry is doing when they purify water, because they make gobs of water. They make it all the time. They make it at very high flow rates. And guess what? It's all cold. They don't convey it in stainless steel pipes. So there are some things we can learn from them. I mean, I don't want to go too far down a rabbit hole. Now I want to talk about the water purification processes that are available to us and what each one of these actually does. And I want to go back and just quickly review the classes of contaminants or impurities that we're going to be talking about as we go through. Okay, so here are the contaminants that we're going to need to deal with. And what I want to do is talk about some of the water purification processes that are available to us. So let's start with suspended solids removal. And I want to give you a practical example. So let's say you get up from this presentation, you walk over to your kitchen sink and you turn on a faucet, and there's some discoloration coming from the water. So you decide to do something about it, right? So you head to the hardware store. Oh wait, we can't do that because we're all on stay at home. But let's say we look on the internet and we want to try, let's assume we can go to the hardware store and we look to buy a filter. What micron size filter do you think you're going to find at a hardware store? What do you think? 1 micron, 10 micron, 25 micron? Well, hardware stores tend to carry filters rated for about 20 to 25 micron. And that's because that's the limit of what we can see with the naked eye. So the logic is that if we can't see it, it's not there. So these are relatively inexpensive filters. These are string-wound filters and pleated filters, and they're what are called nominally rated, which means they remove most but not all of the contaminants that they're rated to remove. Now, there are significant differences between products, and because of the way that different manufacturers test and portray their products, right? Different people spin doctor things in different ways. Now, if we move down the particle size spectrum from nominally rated filters, which actually go down to 1 micron, and typically these use a compression or flat gasket seal. If we move down the particle spectrum, the next thing we get to is a submicron particle removal. This is where we use membrane filters. These are what are called sterilizing grade filters. They're considered absolute. And interestingly, over the last number of years, the test method has come into scrutiny. People have used bacteria, and then more recently, somebody developed latex particles, and they discovered that filters that were effective at removing bacteria weren't effective at removing precision latex particles at the rating of the filter. So, so things kind of get a little bit goofy. But these are absolute rated filters, which means they could be 99.999% removal efficiency. We use a lot of these for sterile filtration. The micron size is 0.1. Actually, some go down to 0.05 or 0.03 micron now. And because the retention rating is so fine, we can't use a compression seal anymore. We have to use O-ring seals. Now, if we go down the spectrum of particle sizes, we start removing smaller and smaller particles, the next thing we come to is an ultrafilter. And now we kind of stop classifying things by their micron size. We start talking about their molecular weight. And ultrafilters tend to be rated at about 99% removal efficiency. The molecular weight cutoff, which is the way they rate these, can be anywhere between 5,000 and 500,000. And these tend to be a tangential flow process. So there is a reject stream. Now, one of the challenges with ultrafiltration, with any filtration process, is what's the shape of the thing they're trying to remove. You can probably appreciate the fact that a 5,000 molecular weight material that's in the shape of a golf ball is probably going to be removed a little differently than a 5,000 molecular weight shaped molecule that's in the shape of a pencil. Okay, now the last thing that I want to talk about, and there are a couple of interim things, but the finest suspended solids removal filter available is a reverse osmosis membrane. These tend to be anywhere from 90 to 99% removal efficiency, and they will remove stuff down to 200 to 500 molecular weight cutoff. In fact, some people have even said they get down to 100 molecular weight cutoff. Okay. Now, when we get down to that level, not only are we capable of removing suspended solids, we're capable of removing the bacteria that a membrane filter removes. We're capable of removing the colloidal materials that an ultrafilter can remove, and we can even remove dissolved ions with a reverse osmosis membrane. And in fact, one of the ways that we measure how well a reverse osmosis membrane is performing is we measure the percent ion rejection, how many conductive elements we're removing from solution. Now, as we go in general, if we look at all of these different devices, as we go to finer and finer particle removal, the cost goes up, the capacity goes down, and we need more pressure. And once we go below the absolute rated membrane filters, we usually need a reject stream or tangential flow to prevent the material from for the filter material from plugging up. Okay, so let's talk about ion exchange. So ion exchange removes contaminants based on their electrical or ionic charge in solution. Here I'm using an example of a resin that contains both cation resin and anion resin. We're using a salt, sodium chloride. Now the cation resin has hydrogen ions on it. The anion resin has hydroxide ions on it. The sodium and the chloride ionize in solution, and the sodium happens to be more strongly attracted to the cation resin than the hydrogen ions. So it literally trades places. So ion exchange is basically a trading places phenomenon, right? We have two different types of resin, and the sodium kicks the hydrogen off, the chloride kicks the hydroxide off. And the net result is the hydrogen and the hydroxide combine, and we have water, and we've removed the sodium chloride. So the water is now called deionized. We've taken a couple of the ions out. I want to talk for a minute about carbon filters. Carbon filters are actually a good complement to reverse osmosis membranes for a couple of reasons. Number one, they protect the membranes. Most of the membranes that are installed in systems now are sensitive to chlorine and chloramine. They can actually be hydrolyzed or broken down by these disinfectants. So we got to take them out. We can either add some chemistry to take them out, or we can install a carbon filter. Carbon filters also remove organic materials that aren't charged. Now, because carbon filters remove low molecular weight non-polar substances, these are substances that a reverse osmosis membrane may struggle to remove. So the two processes complement each other. However, one of the big negative side effects of carbon filters is that because they remove organic material, they load up with food that bacteria loves to grow on. So these filters can be a breeding ground for bacteria. And in fact, some people have said, I don't want to use carbon filters because of the bacterial concerns. That's a subject we can talk about a little bit more if you'd like. I want to talk about ultraviolet units. So these come in two basic flavors, and I'm going to talk about, there are several different kinds of UV units, but the ones that are most commonly used in our industry are called low pressure lamp. They use low pressure lamps, which are mercury vapor lamps, which give off two very specific wavelengths. 254 nanometer, which is used for bacteria control, and the dual wavelength units, which give off both 185 and 254 nanometer radiation for organics and bacteria control. Okay. Now, the way that the 185 nanometer light works, it takes some of these organic materials and it literally puts a charge on them, so it increases the conductivity of the water. And if you're not careful and you don't have this unit in the right place, you'll change the conductivity of the water and you may go out of spec if you're not careful. Now, there are medium pressure UV lamp systems, and these provide a much broader spectrum of wavelengths, and these lamps will absolutely change the conductivity of the water anywhere they're installed. Now, I do want to voice a word of caution about ultraviolet units and the claims that some manufacturers make. There's definitely some misused words here, okay? People refer to UV sanitizers, UV disinfection units, and UV sterilizers. In fact, in the picture that's here, they're called a disinfection chamber. Well, people, manufacturers use these words almost interchangeably, and these words mean very different things if you work in a regulated environment. Sanitize means 10 to the third reduction. Disinfect means 10 to the fifth. Sterilize means 10 to the sixth. And a UV is typically rated for about 99%. That's 10 to the second. So I don't think a UV unit should be called a sanitizer, a disinfector, or a sterilizer. Look around the next time you see claims that a UV manufacturer makes. Now I want to talk for a minute about ozone generators, okay? Ozone is a technology, it's a controversial technology, let me just say that. It is capable of oxidizing organics, it can kill bacteria, it can consume biofilm, and an important thing is ozone is not considered an added substance. In fact, I can talk about added substances for 45 minutes all by itself. And if we want to handle that in Q&A, I'd be happy to. One of the struggles that ozone has had, I will tell you, ozone is widely used in the microelectronics industry, but there are a few people that have tried it in the pharmaceutical industry before completely understanding it. And if you overdose a system with ozone, you're going to have problems. Ozone is going to attack elastomers, and ozone has been kind of given a black eye, and I think unjustifiably so. But because many people in the pharmaceutical industry are risk averse, they've stayed away from ozone. I want to talk about distillation, right? Distillation is considered the gold standard. Every pharmacopoeia in the world, and there are over 140 of them, considers distillation as a suitable way to produce injectable grade water. In the United States, it's considered the gold standard, and however, other technologies that are capable of producing this grade of water are acceptable. Europe recently relaxed their requirement. They used to insist that distillation is the only way to produce injectable grade water. But that's not the case anymore. So let me talk for a minute about how we sequence these unit processes, right? We just talked about a lot of these processes, and the approach to their removal can vary between equipment manufacturers. Generally speaking, I like to remove the particulate, which means the suspended solids and the colloidal materials first. These are the things that can coat filters, gum stuff up, and what have you, right? So remove trace materials, ions, organics, and then the last thing to do is remove bacteria throughout, okay? But definitely, it's one of the last steps would be to remove bacteria. Now, how do we get the water from the mechanical room to the points of use without its quality degrading? Well, now we're talking about the design of pharmaceutical distribution piping systems. And I can probably see this is about as far as I'm going to get with this presentation. So as a general rule, people look for different things it varies from company to company in terms of some of the things that they do. A common practice is to design for at least 5 feet per second velocity, okay? Or alternatively, design for at least 3 feet per second in the return with all use points being active, right? We want to minimize dead legs. Injectable grade water is almost always piped in stainless steel. People have tried to do it in plastic, and unless there's a very strong reason to do so, most people do stainless steel. It's all tried and true. Purified water can be piped in stainless steel or PVDF. One of the most important things to understand is that distribution piping systems for purified water and injectable grade water have to be sloped for drainability. And one of the things that people tend to forget is that we have to size the pumping system and the length and size of the piping system. We have to consider these things together. I think I'm probably going to need to stop right about here. I was going to get in and talk about how do we test the water quality for being okay, but we're not going to be able to do that. And I think I'm going to turn things back to Brian Hagopian and see what we have for questions and answers.
Thank you, Brian. We're going to begin the question and answers submitted during today's presentation. As a reminder, you can still submit questions through Pigeonhole. So our first question, how close are we to being able to use rapid microbial monitoring for quality control or product release purposes?
Okay, so this is a question we could probably take 45 minutes answering, but as a general rule, what a regulator wants to know is what's the quality of water that's going into the product. And in order for rapid microbiological monitoring to be used for product control purposes, we would have to have one of these technologies installed at each and every use point in order to be able to release product. I think we're a ways away from that. One of the other challenges we have with RMM technology is many of them are destructive. And one of the most important things is if we detect bacteria, we have to then be able to speciate. We have to be able to identify them. So, you know, many of these techniques, especially the instantaneous ones, will destroy bacteria as they detect it. So we won't be able to detect what kind of bacteria we might have. So there's the quick answer.
So we have a tie for 2 votes. I'm going to go with the one I like better. What is the biggest innovation in water systems that you have seen recently?
Oh, that's a tough one. The biggest innovation, you know, to me, I've had a lot of experience in a lot of different industries, and one of the most important things I learned, and I definitely learned this a little while ago, but one of the things that I think the pharma industry hasn't really understood is how important TOC control is. And if we can get the TOC levels down into single digits, and as you saw, the microelectronics industry has specifications, you know, where the lowest grade of E1 water has a TOC spec of 5 parts per billion, but now the fanciest grades are 1 part per billion. I think TOC control is something that the pharmaceutical industry would do well to consider. You know, the specification for pharmaceutical grade water is 500, and with that kind of TOC, that kind of level of TOC, you can grow a lot of bacteria. If you can get the bacteria into single digits or down below 5, bacteria actually are going to have a hard time growing, and if there are any in your system, they're going to be stuck in the biofilm, and they're not going to be enough nutrients available for you to see them in the water that you're using. So I guess that's my opinion of the biggest innovation over the last, you know, 5 or 10 years.
Okay, the next question. My site currently uses heat to sanitize our water for injection loop. I'm trying to prove to my QA department that ozone is a better method of sanitizing. We already have ozone capability. What are your thoughts?
I think ozone has gotten a bad name and a bad reputation because it's been misapplied before people really understood. I think ozone is a tremendous technology. You know, one of the challenges that we face is that people understand heat. People know that, hey, if you blast something with heat, you can sterilize it, okay? Ozone can do the same thing. Ozone can penetrate biofilm. Ozone can kill and oxidize bacteria, and it can literally, if you give it enough contact, it can strip biofilm off. People in the microelectronics industry know this and have done this for years. So, you know, I think we're a little behind the curve, as it were. But understand there's going to be a lot of resistance toward using ozone because people understand heat.
Okay,
Next.
thank you.
Okay.
I'm going to skip over the microelectronics one for a minute because you kind of covered that. With cell therapy facilities being smaller, what are the pros and cons of buying water versus generating water in-house?
It's all a matter of, you know, how much control you want to have, and it's definitely a cost thing as well. You know, you've got to look at the life cycle cost. You know, it's expensive to buy WFI water, but you don't have to put in a WFI system to, you know, to produce and validate and predict what your usage is going to be over the next 4 to 5 years. So, you know, it's tough starting up. I've seen a lot of small facilities decide to purchase WFI water just because, you know, the cost to not only install but to validate a system, you know, it can be pretty high.
With the recent events, and I assume this is referring to COVID, with the recent events we have seen, any concerns around smaller particles such as viruses getting through filter schemes?
I would say not if reverse osmosis is involved. A reverse osmosis membrane is capable of removing things down in the 100 to 500 molecular weight range, and viruses are much bigger than that. So a reverse osmosis membrane would be an absolute barrier for a virus. And in fact, viruses are inactivated by heat, viruses are killed by ozone. So any of those regular types of sterilization techniques that are used in the industry should be considered a belt and suspenders approach.
Why do we call it purification of water when we store in plastic containers and there is no cleaning method for plastic?
Okay, yes, I see this question. This is a tricky one to answer. There's been a big push to for parts of the industry to go to single-use technology, and one of the major offshoots of that is a big set of studies on leachables and extractables. One of the things when you polymerize plastic, there are always materials that come with it, whether they're partially polymerized polymers, whether they're additives that are used, and the manufacturer may go through some sort of cleaning process, but you're now going to put super squeaky clean water in that is hungry for anything that it can dissolve, and it's going to pull these things out of plastic. So I'm not sure, did I answer that question? Or is it, are we talking about piping systems?
Yeah, the limited details. So hopefully, if not, we can follow up with more information.
Okay, well, I would tell you purified water is commonly conveyed in plastic piping systems. And what ends up happening with them is, depending on the material that you use, there's an extraction period. And for a material like PVDF, polyvinylidene difluoride, the extraction period is 1 or 2 hours. For a material like polypropylene, most of the extraction happens over 48 hours, but certainly over a couple of weeks. For PVC, it could be 6 months, but PVC doesn't get used in the pharmaceutical industry. So there's a distinction between plastic piping system versus a single-use plastic container.
What final filtration molecular weight cutoff do you feel is needed for membrane-based WFI production? And I would caution you to answer this one.
What final molecular weight cutoff? I'm not sure I want to answer this question. I don't know. I don't know the answer to it. I've worked with several clients. I've done membrane-based WFI systems, and in fact, you might remember earlier versions of the United States Pharmacopoeia talked about the potential use of 2-pass RO, double-pass RO, product-staged RO, where we have literally 2 RO membranes in series. One of the big problems with that technology is if you just use 2 RO membranes in series, you may not pass the conductivity spec. You'd pass everything else, but to me, in Japan, you can use an RO followed by a UF. I've had a lot of success, and I've seen RO followed by UF work. I've used RO with deionization, followed by a second RO membrane. So there are a couple of different ways to do it, but you're not going to pin me down to a particle size.
I think we're going to stop for questions at this point in time. It's 12:58. I'd like to thank Brian for his time and his expertise, and thank you for everyone who joined today's webinar for your interest and your support of the ISPE Boston area chapter educational programs. There'll be a follow-up email with a short survey. We'd appreciate your feedback. You'll also receive an email with a link to the video recording of today's webinar. On behalf of the ISPE Boston and our presenters, thank you again for joining us today. Thank you again to our dedicated sponsors, DPS Group, ICQ Consultants, and Macy Bioservices. Have a great rest of your day, and thank you very much.
Thanks, Brian. Great job.